Welcome back to Season 6 of Inside Medical Malpractice. I'm Chris Rokosh, your podcast host, and I am so happy to be here with you today. I want to thank each and every one of you for listening in today, too. I appreciate it so much, and you are the reason I'm here. Today's guest, which I'm very excited about, is Dr. Noah Kaufman, a U.S. board-certified ER physician with many years of frontline experience in both rural and urban settings. He has a professional record that is spotless. No reprimands, no malpractice claims, and no lawsuits. And he brings a rare perspective on the standard of care. Dr. Kaufman is not only a practicing physician, but also a skilled expert witness in the courtroom, known for dismantling illogical arguments and making complex medical issues crystal clear. Beyond the courtroom in the ER, he's a devoted father, an educator, an athlete, an on-air medical commentator for NBC, and a 7-season competitor on American Ninja Warrior. That's impressive. I'm sure you hear that all the time, but that's impressive. At the core of everything he does is a deep commitment to patient care and justice. Dr. Kaufman is in the midst of writing a book titled The Ethical Expert Witness. The book is not out yet, but I have reviewed the table of contents and had a discussion with him about the upcoming book, so we'll use this to guide our conversation today. We've already had a couple of conversations on the phone before we recorded this podcast, and when I look back, I wish I had just hit the record button the moment we started talking. He's so well-spoken, has so much to say, and the topic of the ethical expert is so close to my heart. So let's get started. Welcome, Dr. Kaufman. I'm so happy to have you here today.
Chris, it is an absolute honor. I'm a big fan of your work, and you're sharing a lot of information in a very informative and entertaining way, and I'm just honored to be here.
Well, I'm honored to have you. Thank you so much. Are you ready for some questions?
Yeah, let's go.
So your book is titled The Ethical Expert Witness. Talk to us a little bit about what first of all inspired you to write it and why the idea of ethics is so central to you and your expert testimony.
Yeah, absolutely. Well, let's jump right into it. I would say that I wanted to be a physician ever since I was 2 years old. I should say a doctor. I wanted to take care of people. I wanted to heal people, make them better. And as I went through life, my motivations changed and were updated. And eventually I found that I really wanted to kind of be the hero and go into emergency medicine. And, I had a really interesting experience when I was in high school in a crowded movie theater where someone started having a medical problem and everybody, is there a doctor in the house? The classic sort of trope. And I was the first person to the patient, and even though I was just in high school, he was turning blue and he wasn't breathing, and I started doing mouth to mouth. I didn't have anything. I literally just went right on his mouth with my mouth, and it was just looking back, it was nuts. I still remember the way his beard stubble felt. I mean, it was kind of a crazy experience. But then an ER doc showed up, and I was like, thank goodness, because I had no idea really what to do. And he was so calm and collected, and I realized that was my calling, and it was a very exciting moment for me. And the way that kind of relates to why ethics is important in both medicine and law is that I think that most physicians and most lawyers, to be honest, go into these fields because they want to help people fundamentally. And I think that, these are two very difficult professions that are very high stress, take many years of our life away from our 20s, away from our family, away from our earning potential as young adults. We sacrifice freedoms. And you really have to have a deep guiding set of principles to succeed in either of these fields as a professional. And being in emergency medicine the last 20 years, I've seen everything, the most tragic things, the miracles. And when I talk to attorneys, and my mother's an attorney, my partner's an attorney, what they do mirrors that. And I've always loved writing, and I've always thought that the intersection of law and medicine was a very fascinating place because it really requires both strong, adept attorneys, but then also educators, because it's not easy to understand what we do in medicine as like very complex biological mechanics. So, when I started my journey into this kind of niche overlap of medicine and law, I recognized right away that there would be cases that were totally frivolous, as most people understand. And I was offered cases, solely as I grew my career and as my name kind of went around and I built a reputation for being impartial. I turn down cases for both sides. I do work for both sides. And I would see experts who, I'm not sure if they've given up on life or if they just have no moral compass. I mean, they've certainly worked hard, but both attorneys and physicians sometimes lose the plot and become focused on generating revenue or making money. And I think that when that happens, the whole system suffers. People suffer, obviously, the clients, the patients, the social justice system suffers because it's bogged down by frivolity. And so I recognize the need to address this. And I think that law and medicine are at their absolute best when motives are not financial, but when people and people's health and wellness and happiness are kind of the central guiding motivating factor for both attorneys and doctors. And so, unfortunately, there's quite a few experts and attorneys even, although I think for attorneys it's actually a bit more forgivable, just vis-a-vis zealous advocacy and the way attorneys are trained. But I think for experts, it is absolutely essential to be ethical. And since there was an unfortunate preponderance of lack of ethics with certain experts that I encountered over the last decade, I felt that this book would be really important for anybody going into who was interested in this kind of unique intersection of health and law. And I think it would be important for both attorneys and physicians to consider ethics and morality as a central tenet to what we do.
I love that answer. And I have an expert witness company and have been an expert witness for many years myself. And I understand the challenge of staying in that ethical, moral space that you're used to practicing as a healthcare provider. Not that the other side isn't ethical, moral, but I appreciate also the comment you said it's a little bit more forgivable with lawyers because they have a zealous responsibility to defend whoever their client happens to be. But I've also had to make some tough choices on cases and had some very specific feedback that I don't take instruction well because I wasn't willing to say what the case required to go forward, but I wasn't because I just thought, I don't want to get on the stand and be faced with that story, which is not maybe true or I don't believe or I can't defend, I guess. So I appreciate that. And I think that has allowed me and maybe perhaps you to still very much feel like a physician and not just an expert witness, but to bring, your healthcare perspective, moral and ethics and practice guidelines into this other role. Is that fair to say?
Yeah, I mean, absolutely. Most physicians, most attorneys, they just want an impartial answer. Most great attorneys that I work with, especially on the plaintiff side, they're giving me cases constantly, and I constantly can't support them, and I'm educating them, and they're so thankful. The good ones are very thankful, and it's great also because the bad ones I don't hear from again, and I would prefer it that way. Although I have to tell you, even most plaintiffs' attorneys that I'm working with are just very good, ethical people, and every now and then there's a real strong case that falls into their laps that's problematic. But yeah, I agree 100%. And I think being impartial is what we're hired for. And I think that becomes problematic for some physicians. I think there is what I call compensation bias. And if you don't have a lot of cases or you're not that experienced, I think that you might be motivated to take a case because the dollar signs and because it's intellectually interesting and it might lead to more dollar signs. And unlike medicine, where our pay has gone down over the last 20 years, inflation adjusted, as an expert or as a lawyer, you do gain more compensation as your time becomes more valuable as an expert, and you're very well polished. So that can create an ethical dilemma that is extremely important to consider and avoid, and always keep yourself, on the right side of right and wrong.
Exactly. That's well said. I also work with a lot of nursing experts. That's how I started. And I work and mentor a lot of nursing experts. And there's also with nurses, okay, so two things. I've talked about this before, how similar doctors and lawyers are, helping professions, a strong sense of self-determination and ethics, a very strong sense of right and wrong, in their view. And also a need to be very intelligent and prepared. There's a lot of similarities between the two professions, but nurses have kind of a different motivation. And part of theirs is that, we can be people pleasers and we want to make people happy and do things right, but don't always set the standard for what is right. So what's right was what you've been told to do, basically. So I have to talk to nurses a lot about that too, on a different, from a different angle, and say, you're not here to please anybody or make anybody happy. And I tell them just exactly what you said. If you guide someone down a path where a case just doesn't have any merit, you're doing nobody any favor just to please someone and make it look like you're, on their side or whatever. So anyway, great answer to all of that. I appreciate it. And I am fascinated by the similarities between medicine and healthcare, how much we love and fear each other at the same, medicine and law, and how much we love and fear each other at exactly the same time. All right, so let's go to the next question. You've talked about this just a little bit a minute ago about why it's important for attorneys to get the right answer and an ethical expert. From your perspective, what qualities distinguish an expert witness with integrity from one who is simply for hire?
Right. Well, obviously, the easy answer is the cases that I've run into where the opposing expert does 99% plaintiff work. And those hired guns are out there. And it's really kind of insane. I don't really understand it, but to be supportive of just about every case shows a clear bias. And honestly, to be fair, we have to say that about defense experts also, habitual defense experts. When I started over 10 years ago, I went into it. I started with Copic here in Colorado and defending emergency room physicians. And I felt like, I'm defending other ER docs. This is great. I'm like, I'm helping them. And I was very effective. There would be high fives after depositions. It was very exciting. It was exciting work. And ultimately, one of the main attorneys who really kind of took me under her wing, she's just an incredible attorney, super, super sharp, Lisa Leisure here in Denver. She said, Noah, you're great. We love using you as an expert witness. You might want to consider doing a little bit of plaintiff work and branching out and doing some reviews, maybe taking. And I was flabbergasted. I was like, really? Why on earth would I want to do that? I thought we're defending docs here. And, this was a couple years in, and she's like, well, it's about credibility too. And, in order to be, you've already turned me down for a case that you didn't think was defendable. And, you really should consider for, if you're truly impartial, then you need to look at any of these cases, and you really need to be rendering impartial decisions, and your credibility will be stronger under deposition in a courtroom and your testimony if you kind of work for both sides and render impartial opinions for both sides. And sometimes it's easy, sometimes it's black or white, but oftentimes it's gray. And the gray zone is kind of where the art of being an expert and like really sticking to rational, ethical, data or evidence supported factual arguments becomes very, very important. And so, the black and white cases are easy. Those are really easy. And that gets into the 100-doctor problem, which I know we're going to touch on. I'd say that's kind of how I got started, and how you can figure out very easily if there's an expert who is not very ethical, as if they're just habitually a plaintiff expert or somewhat of a hired gun. It gets trickier when you have an expert who does work for both sides and then supports a position that is irrational or illogical, and there's some very, very smart experts out there, and unfortunately they can be extremely persuasive. And some of the most effective experts are likable, relatable with the jury, and not just robotic in answering questions and sounding like the smart doctor, but they're relatable. And the real dangerous experts are the ones who are willing to support a position for whatever reason, which is untenable. However, they're very persuasive, and they're very good at debate and very good at creating arguments. So that's really problematic. And those types of experts are almost impossible for an attorney to spot, unless they're a physician also, because they just don't have the medical knowledge. So that's where educating comes in. And so those experts are much trickier to identify, but it's very important that when you do identify those opposing counsel experts, that as expert witnesses, that we have a very strong approach to how we deal with those experts.
I just want to back up to something you said about your early motivation was to defend doctors. How has your motivation changed as you're now 10 years, you said, into expert work? How or has your motivation changed for doing this type of work?
Well, I would say that now so I don't really think about defending or that sort of thing anymore. I don't actually even think about there being a plaintiff or defense side anymore. Now I'm completely trying to help the court. I'm trying to help the court understand impartially the way that standard of care is understood by physicians, and what reasonable care is, and what constitutes reasonable care. And a bad outcome does not mean there was necessarily bad or care or a breach of the standard of care. But also it doesn't mean that, like a bad outcome, obviously there could have been suspect care as well. So now I view my role as being a completely impartial third party, and I don't care which side hires me, they're going to get the same opinion. And, I turn down a lot of cases. And I've turned down cases for both sides. And I think that when you're young, or kind of green as an ethical expert, or as an expert witness, I think if you get a case, someone's interested, maybe you don't have many cases, maybe it's the only case you're considering. And I think that you want to be involved with the process. I think there's a lot of unconscious bias that, like you said earlier, like might make you want to support someone bringing you a case. And so you kind of look at it from all angles and confirmation bias. You try and develop an argument. But that's the wrong way to approach it. And I think experienced expert witnesses who, I have 10, 15 cases at any one time. And even though it's a small part of, I practice medicine much more than I do expert work still. And I'm still fully active in the ER. And, but what I would say is that I don't really care financially, especially being 50 years old, having been in medicine for 20 years. I have investments. And so I love the process. I love the work. I love the cases. It makes me a better doctor by studying and learning and doing the research. You probably find the exact same thing, Chris. But, so I know I kind of went and discussed a whole bunch of topics there. But I would say that now, having a lot of cases allows me to not really, I don't want to say not care, but just like I have to not care in the emergency department. If somebody's dying, I need to take care of them. I can't start getting emotional. I have to take care of them, and then I need to go to the next patient who might also be dying, or whatever happens. I need to be professional. I need to be somewhat removed, and I feel that way about expert work as well. Although expert work has made me cry, at times, which is that's pretty interesting as well. But as I get older, maybe I get a little bit softer.
I think a lot of what you just said there, I can just see that you are a great expert in a lot of different ways, your lack of bias. And I really appreciate too that comparison that you just made to how you have to act in a completely unbiased manner in the ER, and transferring that to your expert work is really valuable. Because I've certainly run into experts sometimes who they'll have not just wanting to please the lawyer motivation or win the case, so to speak, but they'll have a really negative motivation. They've had a bad experience in the healthcare system, and they want to get somebody. They just want to get somebody. And, we have a quick chat really, really quickly and talk about applying your lack of healthcare bias the same way you would treat every single patient who walks through the door, the same way, hopefully, without any kind of preconceived biases. And you have to treat the case the same way. So, and I've also done a lot of crying over these lawsuits, if that makes you feel any better. Mine are all obstetrical lawsuits, and I sometimes see I'm going to cry right now. I just sometimes see a fetal monitor tracing where, a healthy baby walks in the door and its tracing is beautiful. Then there's just 7, 8, 9, 10, 12 hours of too long, too much labor, too much oxytocin. And you can just see that baby tire out and wear out. And then, of course, there's a bad outcome. So those are always very touching to me and to my heart. I've spent my whole life delivering healthy babies and protecting healthy babies. And I still see that as a big role of mine, is to protect the babies and protect the standard of care. Those are my two motivations. I know you didn't ask me that, but those are my two motivations right there.
No, that's beautiful. Thank you for sharing. I mean, yeah, what's more valuable than an infant human, than a baby?
Exactly. So let's move on to the next question. I think you answered that very, very well, and I'm appreciating all your insights and all kinds of things. In the tools of the trade, I know there's a lot of doctors and nurses out there who are interested in medical legal work, but scared of it, or they're just brand new and they don't know how to get started. In the tools of the trade, you talk a little bit about what experts need to succeed. If you're talking to someone out there who's just interested in stepping their foot into the role of an expert witness, beyond medical expertise, what do you think are the tools that every effective expert must possess or develop?
Yeah, absolutely. Well, early on, you have no idea. You go into expert work as a doctor, and of course, that's your primary function. Or any sort of expert, as an engineer or as whatever kind of expert you are, you bring your profession, and that's your starting point, is your knowledge and expertise in your profession. I don't think anybody should should start being an expert witness if they don't have at least 5 to probably 10 years of their profession under their belt. But because you need to see a lot, and you need to understand standards, and you need to understand all sorts of outcomes, and you really just need a lot of experience to do that. So first, you need to bring experience. But what you realize over the years of being an expert is that you're going to be developing different skill sets. So as a physician, you're more effective if you have a good bedside manner, if you can, be likable and relatable with your patients, then they're more likely to follow the treatment plan and believe you and trust you, with their care. And likewise, it's the same way. Being an expert, it's so important to be relatable with the jury and with the other attorneys and with the judge and with the clients, with everyone. Everybody has a pretty good BS meter built in, and I think that being absolutely authentic is, well, first critical to both our professions, but absolutely essential to being an expert. You can't try and please anyone. But I think just being you, being authentic, being genuine is super important. And while that's maybe not a skill, some of the things that are derivative from that are skills, such as being likable, being relatable, and then being an educator and being able to explain in very straightforward ways the way not only are you looking at the matter at hand, but the way that the profession at large looks at the matter. And that's so important. And, I've always been so impressed. The smartest people I've ever met in any profession are the ones who can explain things like so simply. And you just understand, and you're like, wow, that was a great explanation. Like, explain it to me like I'm 5, like I'm 5 years old. And I think that's what that's what the jury wants. That's what I want. Or, if I've been on jury duty type of thing, I would want that. Or if I'm a patient, obviously as an ER doc, I don't know everything. So if I'm a patient, if I'm in the patient role, I want my doctor to explain it to me like, like I'm 5. Start there and let me ask some questions. And I think that doctors, lawyers, professionals, we're there's a lot of ego generally, especially early on. We want to sound smart. Professionals want to sound smart, and I get it. So, use 10-penny words. I think you can get into a lot of trouble, and I think you can lose trust really easily. So the last thing I would say is being quick on your feet, obviously, sticking to your guns. It's funny. I've asked some of the attorneys that I've had a long rapport with. I've asked them, how can I improve and what can I do better? And actually, some of them have even offered and ended up doing testimonials for me, which is great. I have little video testimonials now. And they say, he sticks to his guns, or I like when you stick to your guns and the way you explain things, and I'm not perfect. I have things to work on. And so I ask them, what can I work on? And of course, we have those discussions as well. I'm an open book. I'm happy to talk about that sort of stuff as well. I think that the attorneys that I've spoken with have helped me understand these different skill sets that really come together as a well-rounded expert or just professional in general. And so it's mainly those things: likability, relatability, the ability to be an educator, an effective educator to kind of all levels of your peers and of people who might be educated lay people to people who are less educated. So those are really important skills. And then while they're not skills, honesty, integrity, authenticity, these sort of, kind of inborn, intrinsic attributes, they're not skills, but I do think that, if you can look at yourself in the mirror every day and you can say, I'm a good, honest person, I love myself, and these kind of affirmations, then you're not gonna violate that kind of moral code with yourself. And so it's just like, I have a 14-year-old who I love, and of course we're always talking about, what would you do in this situation, like moral dilemmas and ethical dilemmas? Because my father did that with me growing up, and I thought it was great. And, it's these great conversations, and I think you need to have those conversations with yourself. And if you're getting close to a line, I don't think that there's, I won't get close to a line, but I've had cases, especially a long time ago, where I would examine the case and I would think, is there any way I can, and I would have to snap out of it and say, no, that's not what I'm doing here. This is not like trying to find because like I said, it's very dangerous. You can be a very effective expert if you're persuasive, and if you're quick on your feet and you can create arguments, because as an expert, you have a huge responsibility because you're the one with the knowledge. And you're educating everyone. And so it's very frustrating to go up against experts who are just way out there, where, again, 100 doctors would, raise an eyebrow and be like, what on earth is this person saying? So those are the skills and attributes that I think are important that you can develop over time. And some are easier to develop than others.
Was there one of those skills that was a challenge for you to master?
Well, I think the most challenging skill for me to master is one I didn't really talk about, and that's restraint. It's important not to get emotional, as I was talking about before, but being human, sometimes when you see a clear wrong, when you see an expert who is really crossing the line and being unethical, the natural thing, if we're human, is to get upset, to get angry, and get a little emotional and want to slam the table and say, what are you talking about? Why would you say this? You're disrupting the whole process and you're creating pain and suffering. You're literally violating a fundamental oath that we gave as physicians to first do no harm, because you can do real harm as an expert who isn't ethical. So I think for me, having restraint, in written opinions and in testimony, because there have been times where, very professionally, I'll go for the jugular on an opposing expert if I think that they're way out of line, and I'll call them out. And I'll call them out in front of everybody, and I'll put them on the spot and really question them. And of course, I might do it indirectly, like through writing, or have that conversation with my attorney and help them develop a line of reasoning. And because they're really they're very dangerous and they're very detrimental to the process. The attorneys who I very much look up to and think are incredible at what they do are very honest with me. And sometimes in my report, I'll have to reel it in a little bit, because I'm I wouldn't say it's ad hominem. I'll just say statements like, and I have to question opposing counsel's morality, ethics, when they state, so on and so forth. I'd say that, you have to be careful as an expert not to get into ad hominem or focus on other experts, even if it's frustrating the positions that they're holding. Our job is not to utilize bluster or ad hominem attacks on an opposing expert. And sometimes it's warranted, and I've been in situations where a small degree of that is warranted if it's absolutely, insane where they're coming from. And it's luckily it's somewhat rare. Normally, everybody is, they're more nitpicking points. But, I think that oftentimes the opposing experts who aren't in line are still ethical, and they're just seeing it differently. And I think maybe they haven't asked the 100-doctor question, and they haven't really come at the problem from a more global perspective of what's reasonable way, to practice medicine, and more they're coming at it from what's reasonable for me. Would I have done this? And that's a mistake. And I think that's one of the biggest mistakes that experts make.
I agree with that. That's a really good point. In fact, I just had a talk with an expert about that yesterday, because there was several comments as I would have or she should have. And, in this particular case, that this is how they would have handled this clinical finding. And I had a very in-depth conversation saying, you're not the standard of care, believe it or not. Your practice might be really good, but you do not set the standard of care. So let's talk about this. In this situation, the standard of care requires this response, this intervention, this assessment, whatever the case may be. So teaching some rewording there. Another thing you said, which just resonated with my own heart, is when I was an early expert, I was so scared. I still look back on this and wonder why the hell I even started doing this. But I was asked by a lawyer to give opinion on a case. And I'm appreciating how you said that your skills grew and your attitudes changed over time, because I was just so nervous and I thought I had to be someone that I wasn't. I tried to speak in legal language and dress in some legal suit setup, which is not even in my repertoire, and talk in a way and act in a way. And it was finally one of my sisters. I have 5 sisters, and, nothing gets unsaid. And one of them saw me interacting with a lawyer, and she just said, "Why are you so weird?" And I was like,
Yeah.
Okay.
Beautiful.
Beautiful.
Count on your family for honesty.
Exactly, right? Why are you so weird? You're acting so weird. So I really gave that some thought, and I just went back to being me and the teacher that I was and the person that I was and dressing like I did. I started showing up with banana bread at the lawyer's office, which would be my instinct at anybody's office. And I became a very busy, successful expert, but I had to understand that my role, I had to have a lot of legal knowledge and knowledge about the legal process, but my job was as an obstetrical nurse. My medical knowledge is what I was bringing to the table and not pretending. And that's what made it sustainable for me, because I've been an expert now for 25 years. And I think if I tried to be someone other than exactly who I was, even the first time I was on the stand, I kind of lived my life with this small perpetual smile on my face. And I even gave testimony on the stand the first time, probably smiling just a little bit like I'm smiling right now. And afterward, the lawyer said to me, he said, "You did an absolutely outstanding job." And that smile on your face, I was going to come up at the break and tell you to stop it. But I understood that that's just who you are and how you are, and letting me be that person and my ethical, truest, most comfortable in my own skin self is what made the day for me and makes it doable and keeps you on the right path, keeps you ethical and moral because you're being yourself. You're being your best self. Anyway, we've talked a little bit about the human instinct to want to support the other side that retained you, but let's talk about when you get a new case. How do you just approach it from beginning to end, balancing the facts with your knowledge, with the objectivity, and where do you even start?
Yeah, that's a great question. I mean, and I recently wrote a blog post about this, approach to a new case, and it's interesting. If it's a new client, like a new attorney, and I don't know what side they're on, if I can, I interject super early and I say, "Hey, if there's a way to review this blind, just send me here. Here's my fee schedule and my CV. Let me take a look, and then let's have a conversation." And so I try and look at these cases de novo, like from scratch and without knowing. That's not always possible. And obviously, a lot of my clients are repeat clients now, and I know already if most attorneys either work for defense or they work for plaintiff. And it's always a little bit different. But the first thing that I'll do is, whether or not it's a blind review, is I'll sit down, I'll look at the records, and I'll go straight to the notes. Obviously, I'll look at the vital signs. I'll look at kind of the most pertinent pieces of information. And most of the time, I don't know the outcome. I don't want to know the outcome. And I really want to put myself in the position of this doctor. I want to think, okay, was the emergency department busy? Because I know that changes how we practice. Was it not busy? What was the environment like? How busy of an emergency department? Or was it a rural emergency department where there's maybe not much going on in the middle of the night? And so I try and think, what was this like for this provider seeing this patient? And if there's I usually do a quick kind of high level look through everything. I look at vital signs, which are actually super important, as you know. I look at charting. I look for obvious red flags and logical inconsistencies in charting, or good medical decision making where physicians, talk about their rationale or their approach, because sometimes that is super important and can be even a linchpin in the matter. And so I'll take a very high level approach and see if something jumps out at me. And sometimes, no matter which side I'm looking at, I will literally find something like I'm looking for a needle in the haystack, or a couple needles. I look for when other consultants might say something that is a little unusual, something like, I wish I had been called earlier, or this is the most extreme example of XYZ that I've ever seen in my career. Things that make you kind of say, why did they say that? And you're trying to piece together the whole case. Obviously, you weren't there, and you have to rely on the documentation. So I do a high level kind of scan, and I'm typically not taking notes. Sometimes I'll take photographs of the pages in the document, because we get like sometimes 1,000-page PDF, and we scroll past the gobbledygook, all the orders in the computer, the CPOE entry, all that stuff. And you're looking for paragraphs where people are writing things, and a lot of times these documents are searchable. So you can search for vital signs, or you can search for, the physician, or you can search for emergency department note or whatever. And so I'll take a high level approach. I'll take pictures of pages, without taking specific notes, because notes are discoverable, of course. And so in deposition, they're going to ask you, can you please give us all the notes that you've taken on this matter? And if I'm just giving them photographs off my phone, then it's the same thing as, them having the PDF. And then they can ask me, well, why did you take a photograph of, Bates page, whatever. Bates means the numbering system for looking through like a PDF or a discoverable document. But and that's a lot different than taking a note, which you might put a question mark, and then they can say or there might be some kind of evidence of bias if you like underline something and say why question mark. They might really try and use that against you. And so early on, I realized taking notes isn't great. But if you take a photograph of a PDF, all it is a photograph of PDF. They can't read your mind, but you might, see something really important there that is very important. And then I'll keep those photographs in a file. After I've done my first review, I'll typically want to have a quick conversation with an attorney. And then I'll try and I will have created a prima facie opinion. And with that, kind of first glance opinion, I'll speak with the attorney. And sometimes it's just clearly like, hey, I took an hour or an hour and a half to review this. I could go a lot deeper, but here is my real quick initial cursory opinion. Let's talk about, now what the claim is, where, and then I don't want to look at the claim because it doesn't matter, So early on, it's got nothing to do with it. But then I talk to the attorney, and they'll ask questions, and then I'll always offer, look, I can go back and do a real deeper dive. But it's usually pretty clear whether it's going to be, and my kind of heuristic is my rules are, if it's black and white and obvious, then it comes down this path, and then it's like supportive, yes. Not support or supportive, no, and that's very easy. This is the easy chain. Okay, the not easy chain is gray zone, which is the 100 doctor problem. And we could talk about that. This is like 100 doctors would do the same thing or not do the same thing, or not do it. This is like 50-50, 60-40, those kind of situations. And we're hinting at a conversation we're going to have in a little bit here, but then supportive and not supportive. And that's the main branch, the main tree that as experts we need to decide. And you have to let a little, you should always be open to your emotion and your spidey sense, as it were, of if you're starting to entertain going down a certain branch and there's any reservations at all, you really have to ask, why am I having reservations about that? And then try and steelman that argument, or at least look at the other side and understand, and it gets tricky. Some of these cases get really tricky when they're more in the gray zone, and then ethics really comes into play, because I don't think as an expert, especially in healthcare or medicine, that we should be supporting, for example, a plaintiff's case where the care was reasonable, such that maybe 30% of providers might have gone down that road. Maybe it wasn't the most obvious thing, but it's a complex problem, and it's not a black or white issues, and there's lots of ways to approach it. So, you really that's where it some of these cases get very, very interesting. So that's my approach. I talk to the attorney. I usually take that cursory, high level view, looking for things that kind of stand out to me. I come up with a real quick opinion, and then we discuss it. They then usually will give me areas to focus in on that I maybe hadn't considered. And then I go back and do a much deeper dive, and I see what the actual claim is. Now, of course, up front, if I know what the claim is, whether it's defense or plaintiff side that I'm reviewing for, then of course I have to keep that in mind from my cursory, my initial review. But I usually find that if you dig to the bottom of a well immediately without taking a break, you get real tired and overwhelmed, and there's just so many facts in these cases. So I think it's useful, don't bite off more than you can chew. I think it's useful to take these, digestible information packets, approach the case in a very realistic way, where you're starting to get an overview of the whole thing, of the whole matter, without really understanding deeply, the reasonableness of care, and then talk with the attorney. You might have a specific opinion, which is, I didn't really see anything jumping out at me, or it might be, I saw a couple things that were, worrisome. This is what I found, and then, what are you guys looking at? What is the, and then of course, it later then becomes more subdivided into causation and how, and can you make statements about causation, because that's very, that's obviously super important to these matters. And then you start to get more granular as you take your next review and have conversations with attorneys. But the more communication you have with your attorneys, the better. And I think that it's kind of like reading a book. And I think a lot of experts are very busy. So staying focused, when I put myself on the clock, I am like in a bubble. All distractions go away. The ringer goes off on my phone, and everything is hyper focused on this case. And I don't do it in the evening. I don't do it after a long day. I don't do it after work. It has to be when I'm fresh and I'm coffeeed up and feeling good, and in a good mood. All those things affect your ability. And, it's all about quality, as it is with our professions and treating people. You can't rush these things and you can't rush opinions. So that's my approach. Of course, I could speak about each. I could write a chapter and do on most of these about each portion of that. But that's my stepwise approach. It's almost like in trauma when we have like an A, B, C, D, E, airway, breathing, circulation, all these things. We have that sort of approach. It's very useful as an expert to have a refined and systematic approach to looking at these cases.
That was a great answer. I like your algorithm of yes, no down the road. And I'd like to talk about some of the cases, but I think we'll do that in a couple of minutes because case stories are always fascinating to everybody. But then beyond what you've sorted out with the attorney, what the issues are that you're going to address, does it go out to draft report, final report, or what's your next step once you've made the decision about what's going to be included in your opinion? Where do you go from there?
Right. Well, if I'm non-supportive, which is these days is close to 50% of the time. If I'm non-supportive, then I'll write up an invoice for an hour and a half or whatever it was. The attorney is generally very thankful that they don't have to pursue the matter. And most of the time I offer to speak with their clients in a pro bono fashion. And this has been very rewarding for me. I feel like it's part of our job, and I certainly don't feel it would be authentic if I charged for this, but I like to get on the phone with someone and explain, look, I know that your father died and what a horrible, tragic thing. And I reviewed everything, and my job is to be impartial and just, and sometimes, I let them know that, I want you to know that, there are experts who, if they took this case, could bill by the hour and could make a whole bunch of money. So I want you to know that I'm telling you this because I really care and I feel bad for you, but I didn't find a lack of standard of care, and this is why. And then there's a question and answer. So a lot of times I'll do that pro bono, which I think is important so that they can have closure or understand or have an opportunity to ask an expert. And that will be the end of it. So if I'm non-supportive, it's pretty easy. If I'm supportive, then yes, it generally turns into writing a preliminary document. Sometimes I'll be asked, it depends on the state. In Nevada, it's a declaration. Some states just want a letter of merit. Some attorneys want an affidavit. Some attorneys just want me to jump into a medical report or opinion. And so all of these different formats, early on, I don't think I really had a good understanding or feel for why an attorney would want a different format or how the formats even differ. But now I have like pretty much a template for all of them, and I introduce myself in the beginning, and which I have to update from time to time. And then I'll get into the meat of it. And depending on how deep I need to go, I'll write a draft. And a draft usually takes, if it's a letter, it'll take just an hour or it'll go up to 3 or 4 hours. But if I'm supportive, I'll submit a retainer, and that's refundable against work. Some experts are all over the place with how they work their fee schedules. There's no real clear systematic way, which is part of the reason why I'm writing this book, because I think that some of these things would be beneficial to have a more systematic approach. As a matter of fact, I think the whole system would benefit if we were to review everything impartially on panels, and you didn't even use, individual experts. And I say that to my, potentially to my own detriment. But I've been on peer review committees at the hospital where we, independently and impartially, it's multi-specialty. We review cases, and it's behind closed doors, and it's not discoverable, and it's for education, and those are fantastic. And we sit around with a whole bunch of docs who are different specialties, and we talk about standard of care. And I'd say that really taught me standard of care well, even more so than being a medical legal expert witness. But so then I'll submit a retainer invoice. And then I'll go back and forth with the attorneys, and attorneys are so smart. I'm so impressed with the attorneys I work with, and most of them they'd make great doctors. They're just so smart and logical, and while we're knee deep in science and evidence and taking care of people. They're taking care of people, but they're knee deep in logic and arguments and reasoning, and it's really fascinating. And so then there'll be a back and forth, a really nice, and we'll try and I think that it's always important for me, being now an experienced expert from both sides, to present how the opposing experts are most likely going to look at this. And the attorneys, love it when I'm like, look, this is where I think it's a little bit weak, especially on gray zone cases, because that's where kind of you really need skill. Because the black and white cases, anybody can do, and they're obvious, and they go away. Usually they're dropped or they settle for pittance, but the gray zone cases are really important. So, we'll have conversations with multiple attorneys, especially if they're bigger firms, about the strengths and weaknesses, and I'll help develop lines of reasoning and questioning for opposing counsel's expert witnesses. So if we depose, not we, but if our clients, if our attorneys depose opposing counsel's expert witness, there are questions I want to ask, like logical questions, and questions that I think can easily dismantle arguments. And I think that's been extremely helpful. So I'll have, I think that experts, that's the other thing that I write about, is as experts, or sometimes even if we're not supportive, being strategic consultants can help. And generally, if I'm not supportive, I'm not going to, be a consultant for an attorney and try and help them create some argument that's going to help them in their case. But sometimes, there are cases where, for example, they don't need an emergency medicine expert. Because they need an OBGYN expert, or they need a neurosurgeon or something like that, but they still want to use me because of my experience. And although I can't opine on what a neurosurgeon should do or shouldn't do, after 20 years being in the emergency department, I can still help them create questions, lines of reasoning, understandings about it, still can educate. And we deal with neurosurgical patients all the time. So, part of what I write about is how there's a much more broad way to utilize experts and their knowledge and expertise about a specific matter. And then, after that's all said and done, and the report is written, as usually the case will go into stasis. It'll go into hibernation and then sometimes there'll be a rebuttal to write, but and I keep a master spreadsheet of all my cases and where they're at and what, to-dos. But sometimes cases started 2 years ago and I need to revisit it, and I need to reread my opinion. And as an expert witness, it is critically important to understand that your opinion can be updated and your knowledge and understanding can be updated after more information is brought to light. And that happens on occasion. And sometimes, you grow a relationship with these attorneys and with people, and it's tough, but you need to stick to your ethics and your morality, and you have to say, hey, my opinion's starting to change in this matter, and here's why. But that's really important because, attorneys, nobody wants to go to trial because that's where all the risk is, because then everything can go against you, no matter what side you're on, because now all of a sudden you've got a judge and jury, and, if people are persuasive, depending on how it goes. So you can really help your attorneys just with that updated opinion. So that's a little bit more granular and really getting into the weeds. And there's, of course, more to it. It's a very nuanced subject. But that's kind of the next parts of the case when I'm supportive is, write the opinion, have discussions back and forth, maybe help develop lines of reasoning and questioning for depositions, and then ultimately have a deposition myself, schedule that, do prep and review, and then, if the cases don't settle, very few cases actually make it all the way to trial. But when they do, then that's when it's time to go and testify, put on the suit, and that is my absolute favorite moment, is being in the courtroom. And there have been some moments that are so memorable and really incredible, where a lot comes together in the theater of the courtroom, where the truth is then laid out from every side, from every perspective, for a jury to consider. And that is just a spectacle. It's a marvel, and I think it's a really beautiful thing.
Can you share a specific memory of a moment that you just described?
Oh, there's so many. Okay, yeah. Okay. Well, this one is kind of funny and lighthearted, so I think it would be appropriate, and it's not it's not an active case or anything. So I'm gonna change out some details just out of respect for everyone. But I was actually a plaintiff expert witness in this case, and it was a very unfortunate case. And let's just say it was like very clear, like 100 out of 100 doctors would have said, "Oh man, this is too bad. This was a real problem." So it was one of the few chances where I've actually testified in court on plaintiff's behalf. But and I won't get into the details of the case, but it was a horrible outcome of a young patient that was completely avoidable and had causation, and it was just a very, very, very sad case with where things should have gone very, very differently. But in any event, I was under cross-examination. We had just finished direct, and the opposing counsel attorney was extremely stern. And this was a courtroom just filled with both sides, and hundreds of people. It was a large trial, and the jury is sitting there, and I'm in the kind of the hot seat in the middle of everything, facing the jury, looking at the jury, and opposing counsel is standing there, kind of bare knuckle gripping the podium, and very stern. And Dr. Kaufman, do you mean to tell us that you're here today representing all physicians when talking about standard of care? Are you representing all physicians? And it was just silence, and there was so much tension, and I didn't even do it justice. I mean, he was really attacking me and like putting me on the spot. And I just felt like it was just instinct. I needed to, change the whole feel in the courtroom, because it was so serious. And it was a serious matter, but, I said, well, I do come here representing all physicians, and we come in peace. The whole courtroom erupted in laughter. And, normally you see, in the movies or TV, the judge is slamming the gavel and order, but no, the judge was laughing and everybody was laughing. And it was a little bit of a gamble. And I've never done anything like that since or before, but it was just a moment that had to happen. And I'm a little bit of a joker at times anyways, but and it was really funny. And later on, my attorneys were like, wow, we've never seen anybody dunk on opposing counsel like that. They were like, somehow that was perfect. We would have advised anybody to do that. But so that was really interesting, in courtroom theater. And it just seemed like he threw me a softball. It just kind of had to happen. And he turned beet red, and he didn't really recover after that.
Well played, you.
It was funny.
We just talked about a lot of stuff, and it was all fascinating. But there's two things that just stuck in my head that you mentioned. I first of all want to talk about the fact that you take the time when you have a non-supportive opinion to have a conversation with the plaintiff or the plaintiff's family. I mean, that doesn't happen routinely in my world or with any experts that I've ever worked with. But I appreciate so much that you do that. And I could only imagine that it's incredibly healing, not just for the family, but for you. It must feel good as an expert and as a physician to be able to set the record somewhat straight.
It does. It's very meaningful, especially to offer to do it. And then obviously that's not something you charge for. It needs to be completely authentic. And it's powerful. And I would encourage everyone to do it.
And it's so interesting for me because our next podcast guest, who I'm going to be recording tomorrow afternoon, is a defense attorney who talks about exactly that, about how open, transparent disclosure heals not just the patient and not prevents or reduces litigation, but it heals the physician. It heals the physician and it heals the nurses when everybody has an opportunity to discuss. And you're not, the treating physician, but I'm so fascinated to hear that you as an expert witness, you find that healing and a good thing too, because it's an angle, there's a lot written about how open communication is great for the patient, great for the system, great to reduce litigation, but there's also written a lot about litigation stress on doctors and nurses, but I've never put the two together, how an open, transparent conversation between a doctor and the patient who's had the adverse event, and we're not talking guilt or fault or standard of care, we're just talking open, honest conversation heals everybody. So that really hit my heart. The second thing is I so much appreciate how seriously you take this work, that you're sure you're rested and coffeed and quiet and not exhausted and in a quiet place. I very much impress that on all of our experts. In fact, it's written in our letter of agreement that this is very important work that you're doing, and the outcomes of malpractice cases have the potential to affect patients, families, doctors, nurses, healthcare systems, social systems. And it's important that you understand that and give it the weight that it deserves. So thanks so much for bringing that up. We're just on the same page about so many things, which is fascinating and interesting. You've talked quite a bit about, or you've brought up a couple of times, the 100 doctor question, and I love this idea. Can you explain that, what it means, and how it shapes your view of the standard of care in malpractice cases?
Absolutely. Well, I kind of came up with this concept when I was educating a jury in a case, and I was on the defense in that case, and I let them know, because juries might be told what standard of care is once, but they might not fully get it, and really, it takes illustrations, because if you tell a jury standard of care is prospectively looking at a case and what would be reasonable for a similarly trained physician in a similar environment, and this is how you need to approach it. Well, a lot of those words might just be going past them, and they might be nodding, and but these are normal, salt of the earth, good people generally, and these might be a lot of words that are coming together in a way they haven't heard before, and the best way we learn is visually and through analogy. And I was always a very visual learner. So I came up with this way to kind of explain it to a jury. And I just remember sitting in my peer review, and we only had like 15 docs in there, OB, neurosurgery, neurology, internal medicine, ER doc, so on and so forth, all the specialists. A psychiatrist would actually come in, but it got me thinking, when I do this work as an expert, I have to pretend like I am a panel of 100 doctors personally, like I have 100 different perspectives, and I have to think. And what I explained to the jury was, we really have to think of, if there were 100 doctors in this situation, in the same situation, and they were seeing this patient in the same situation, how many doctors might might use this medication? How many doctors might use that medication? And the example I would give is, if there's evidence to support, evidence-based medicine. So for a heart attack, we always give aspirin. Everybody gets aspirin, period. 100 out of 100 doctors would give aspirin. So if you don't give aspirin, that's minor and probably wouldn't be a cause for a claim or be, it would be difficult. But if you didn't give aspirin in that case, well, 100 out of 100 doctors would. So you better have a good reason. Oh, they were allergic to aspirin or something like that. It gets a little bit more confusing when it's not a black or white issue. So let's say somebody comes in with some abdominal pain. Well, not all physicians might do a CT scan, but some physicians might. Some physicians order a CT scan on everybody, and some say come back in 12 to 24 hours if it's getting worse, which there's evidence that that's a reasonable approach. And so let's say you have someone whose vital signs are normal, like their heart rate, their temperature, their blood pressure. And as a doctor, you say, well, you explain the risks and benefits to the patient, and you say, well, we don't need to do a CT scan. You've had a couple this year already. I don't want you to have too much radiation. Let's see how it does over the next 12 to 24 hours. And if it's getting worse, come back. That's totally reasonable. But let's say only 20 out of 100 doctors would approach it like that. And other doctors would just, without even thinking, just pull the trigger on the CT scan because that's the easy thing to do. You find out right away. It's, and that's becoming, unfortunately, the way medicine is practiced more and more, is order the CT scan. But it's reasonable not to do it. And then let's say there's a bad outcome, okay, and something ruptures and emergency surgery, and the patient's left with some kind of bad outcome. Well, you really need to go back and you have to ignore the outcome, and you have to say, well, if there were 100 doctors, how many doctors would have taken this approach? And then it becomes, obviously you can't say 26 doctors, but you can say plus or minus 5 to 10 doctors. You could say, having been in the field for over 20 years, I can say, well, I know, having seen tens of thousands of cases, that 20% of my colleagues would not have ordered a CT scan in this case. I might not have ordered it in this case, based on the vital sign, based on everything that we're seeing. And so that's kind of the 100 doctor question. And so when I was explaining to the jury, I said, if there's a certain number of doctors, say 20, 30, 40% of doctors out of 100 who would have approached this problem the same way, then, as tragic or unfortunate as the outcome is, we don't have a crystal ball. We're not clairvoyant. We're here to practice the best medicine possible. And if you were to do a CT scan on everybody, no matter what the abdominal pain was, you would see rates of cancer go up and of all sorts of problems. And IV contrast, you'd see anaphylaxis, and people would actually, there would be downside risk. And then when you explain it that way, people understand and they get it, and the jury got it in that case, and ruled in favor of the defense of our side. And the attorney was like, that was a great way to explain standard of care. I never heard it explained that way. So I have a whole chapter in the book about that. And look, it's really easy when it's 100 out of 100 answer. If 100 out of 100 doctors, or even 99 out of 100 or 98 out of 100, something like that, would have done something a certain way, well, then that's clearly standard of care. But, it wouldn't be a profession if there wasn't different ways to approach different problems. And we all look different on the outside. We all look different on the inside. And every case is different. Nobody reads the textbook. So it's really challenging to be, a physician or a nurse or nurse practitioner and a healthcare provider. And, it's important to relate to attorneys, the judge, and juries, and everybody who's in attendance and trying to understand the matter and what went wrong. It's important to understand that, we do the best we can with the evidence that we have and data to support it. And as long as you're not like way out in left field, it can be reasonable to approach a case in a certain way. And, there's so many examples of that. And so, it's really important. And I use that as a guiding principle often. And as, you asked, how do I approach a case? I think I do this subconsciously now. But it's really important to say, well, if 100 doctors were in this situation and doing this, providing this care, how many would have done it the exact same way as this physician, or very similar? Was this reasonable? And if the answer is 50% might have, well, then that's just reasonable. It's just reasonable care. Even if you get down to 25% in certain cases, that can be reasonable. Because, it might have been 25% would have done this, 10% would have done this, 30% would have done this, and people might have done, there are cases where you take 100 doctors, you're going to get 100 different things, approaches, because it's a complicated case with congestive heart failure and diabetes and a heart attack and a stroke and like all this stuff at the same time. It's not easy, and you're 20 medications. And so those cases, and multiple visits, and multiple providers, it gets more and more reasonable to, as long as you can support your care. So that's the 100-doctor question, and every case can be broken down and answered in the 100-doctor question in literally 5 minutes and explained. And if you can do that effectively, then it's a great way to educate the courtroom and do a real service, and that's what we're hired to do.
That is a great explanation of it. I'd never heard that till I read that in your book, but I think it is a great way to answer it. And just to be clear, it's not like you actually go out and survey 100 doctors. This is right. This is based on the established standards of care and what was reasonable at the time. I appreciate so much that you brought that reasonableness up, because it's easy as an expert to get onto perfection. This is how it could have, should have gone, or I would have done it in hindsight, always in hindsight. But I think the reality of what you described of the patient and their wishes and the angry husband beside the bed and the crying baby in someone's arms and the chaos in the room and the pre-existing beliefs and thoughts and wishes of the patient themselves and the language barriers. I mean, there's so much.
So many variables.
Oh, so many variables, and just making a simple decision whether or not to start an IV or give a medication sometimes, right? Which might be exactly the standard of care, but there are barriers to getting there, to the basics, and definitely to the really tricky stuff, the really tricky treatments and diagnostic testing.
That's right. And that's why documentation is so important. And I actually have a whole podcast coming, another podcast I'm doing for the L Word, which is another great podcast. And I'm definitely going to mention this podcast on there. But and we're going to talk deeply about documentation and get really deep into that. So you're absolutely right. How this is all memorialized is also very important. And all those variables and what went into the medical decision making, especially in cases that you identify that could be risky, more risky. Those require, and then you don't want to over document, but yeah, I mean it's fascinating. This whole area is fascinating of medicine and law.
Yeah, it is. And that's another spot where I think your spidey sense, which you referred to earlier, can come in. Sometimes you just know that doesn't matter how this turns out, it's not going to go well on some level. And this is going to come back.
That's right.
And I want to thank you for mentioning the L word, because after you said it to me last week, I listened to a couple of her episodes and just fantastic. I agree with you.
Yeah, Gita's incredible.
Yes. What's her name again? I'm sorry.
Gita.
And she's a doctor interviewing mostly doctors who've been involved in some way in litigation. And it was just great. I blew through 4 episodes in an afternoon. And
both you guys are incredible resources for physicians and attorneys. You guys have my favorite podcasts.
oh, thank you very much. You're now my favorite guest for saying that. Thank you.
Oh gosh. Well, it's an honor to be on your podcast, but I get to go on her podcast. I mean, it's like, wow.
Yeah. So
I went from listener to, a long time listener to
a guest, and a great guest. So thank you. We're an hour and a half almost into it, but I want to get a couple more questions in. I feel like we could probably talk for 17 or 18 days. But I'll try to get 2 or 3 more questions in before we end up. One thing is there's a chapter called Depositions and Intellectual Dance. And I have a very personal interest in this because I have a pretty messy deposition coming up on Monday. And I haven't been deposed for a long time as an expert because I haven't done as much expert work. I decided to kind of slow down about 5 years ago. But let's hear from you. What makes a deposition successful? And what are the mistakes that experts often make?
Yeah, so depositions you could write a whole book about depositions. And depositions, I've done so many depositions at this point. It's an incredible opportunity for a lot of nonverbal communication and a lot of deeper understanding of the matter for both sides. A lot of cards get laid out on the table. And, one of the, obviously on the surface, the opposing counsel is trying to find out, and they tell you this, of course, what you're going to testify about. And they want to know specifically what you're going to say, what you're not going to say. And it's a little bit of like a pre-run for how, what they're going to figure out. And they can use your report. They can kind of dig deeper into your report, into your opinions, and get a really clear understanding of why you said the things you said, if there's logical inconsistencies. And that's generally where, as experts, if you're not really solid and you're not 100% convicted and you don't have evidence to back what you're saying, that's where things can fall apart and get messy really quickly. And not only that, opposing expert is also evaluating you for how likable you are, how nice you are, and how you're going to come off to the jury. What level of risk do they have putting you up there and you being able to explain to the jury, and you being an expert that is going to sway the outcome of the case, in the favor of the side that you're supporting. And obviously, since they're on the other side, they want to know, because attorneys are always sizing up the risk of actually going to trial versus settling. So good attorneys will have mostly perfected their deposition style. And some of them are brash and emotional and try and get you riled up. Obviously, more important than just about anything is remaining calm, cool, and collected. Nobody's dying. No babies are going to die. No, you don't have anybody on your table. You're the expert. So you're the one with the real medical knowledge. And you have to remember that you're impartial. So it's important to concede when there are great points brought up by opposing counsel. You don't want to be defensive. You don't want to be emotional. You don't want to get riled up. You want to be unflappable. And some of that is just, experience and doing deposition, but a lot of it is being fully convicted in your mind, having full conviction that you're on the right side of this matter, and you would not have supported it if you couldn't support that with evidence-based medicine or data, obviously some experience, and logical facts of the matter as they've been presented to you and as you've discovered through the review of the documentation. So when the deposition starts, there's always that easygoing initial period. Well, oh, where do you live? And how long have you been a doctor? Have you ever, all these things, all these introductory questions, and kind of the just the normal procedural flow of a deposition. But then as you really get into the deposition, the things where experts get into real trouble are hypotheticals. There are several specific example of places where you'll get into trouble. A good attorney will be asked, frequently they'll ask you the same question over and over, try and get you to answer it differently, and then attack you for that, trying to get you to answer a question differently than in your report. And a lot of times they'll use hypotheticals, which they're fully allowed to ask. And if you are completely defensive as an expert, you have to be careful and remember, a lot of these attorneys have read books on deposing experts, and they are well studied on how to lay traps for experts. And it's, that's why I describe it as somewhat of a dance, because you need to, it's almost like as an expert, when you start to get into, you really want to obey your spidey sense again. You want to have that feeling. You want to be on kind of high alert for when you're being pulled into a trap, some sort of a trap. Because, look, it's not that hard if you're well practiced to put someone into some kind of a logic trap where you can try and get them to say something that you can use against them later. And attorneys are very good at doing that. And when it comes to hypotheticals, an attorney on the opposing counsel can really win in two ways when they're presenting a hypothetical. They can win if you say, I'm not going to entertain a hypothetical that completely didn't happen. I'm not going to answer that. They can win if you sound like that, because as experts, we are supposed to some degree answer hypotheticals, and you can ask hypothetical questions of experts where you can't really of other witnesses and in deposition. So we're in this kind of unusual place where they can really kind of pick our brain. And it's important to have a well-reasoned approach to the hypothetical question, and then they'll ask questions that say, well, look, I know you're saying prospectively this was reasonable, but let's just say hypothetically you knew that this was the outcome. Would you still do the same thing? And then the easy answer, of course, that they trap everybody in is, well, no, of course, I would do something different if I knew the outcome. Oh, so you would do something different. So hypothetically, you would have done something different knowing the outcome. Yes. Well, then why wouldn't you have, and they can like really kind of, and you can feel when you're starting to get into that trap. And, there's a lot of other examples of this, but the way to avoid these traps, and there's a really great way, is there is no rush to answer any question. And when you answer questions instinctually, rapidly, as quickly as you can, that's what their questions are designed to force you to do and designed to get you into trouble. So if you take a pause, you can always stop or pause and say, let me think about that for a moment. And silence. There's no problem with that in a deposition. And you can think about it. And you can always say, can you repeat that question? Can you ask that in a different way? Because I'm having trouble understanding exactly what you mean, by this. And a lot of times, actually, that will trip them up, and it will be hard for them to restate it. They'll want to restate it because they want you to understand what they're asking. But it's important to be able to give yourself time to compose a logical, rational answer that is not emotional, that is not impromptu or extemporaneous, that is illogical, because these questions are designed in a way to really kind of trap us. So there's a lot that I can say about deposition. We could go into 100 different things, and books have been written about this. But the place where I see experts getting, when I read transcripts, when I'm in a deposition, I've definitely been in a deposition where I was asked a hypothetical recently in the past month. And I started answering the question, and it's almost like I'm reading a teleprompter and I'm reviewing what I'm about to say. And so I speak very, very carefully and in a very kind of slow, calculated manner. And I slow down when I'm really being put on the spot about something hypothetical or philosophical or theoretical. And recently, when I was in deposition, I felt that I was being trapped. I felt that spidey sense, and I was about to say something, and I was like, internally, I had a dialogue, and I was like, I don't really want to say that because it's just not true, and it leads down a slippery slope. And so I was able to, reel it back in and think and intellectually dance or intellectually spar my way around it. And at the same time, your job is not to be persuasive, but you have to remember that it's somewhat of, they're trying to find a way to really make your position weak or discredit you. And so, again, I have a couple chapters dedicated to this. So there's quite a lot.
I think that could be a whole conversation, a whole different podcast, because every trick that you just said has happened to me, or I've seen it happen. And it is tough. It's really tough. I was once on the stand for 2.5 days as a nursing expert in a case, and it was exhausting. I had to change my shirt so many times. I can't even tell you. I was just this hot, sweaty mess. But I did, at first you're just like in a small panic, and then you kind of catch on to it, and you're like, calm down, slow down, listen carefully, trust your spidey sense, know your stuff, speak your truth. And it did okay. It was a successful case at the end, but it was I literally, it took me a few days to recover from that. It was so much mental and physical energy.
It can be stressful.
Yeah, so I appreciate everything you just said.
There's one more thing I would add, which is a lot of times attorneys will use, just like businessmen or anyone else, they might use emotion, or they might use fabricated frustration, or there are a lot of attorneys who will pound on the table and get frustrated and doctor, we can't talk if you're not going to answer my questions. Will you answer my question? And they'll use devices to make you feel uneasy. I'm the one asking questions, and there's a lot of power dynamic in some of these depositions. And so, outside of the factual components and your testimony, there is somewhat of an intellectual sparring component and a dance. And so when I love when attorneys are hot-headed and when they come in and with, all fists, coming at me, because I love disarming them. And so I've said during deposition, I've said, hey, look, you seem a little bit flustered or frustrated. Would you like to take a break? Because I know that things are getting a little bit heated here. And I've just said that to the opposing counsel, and it's been years and years of doing depositions, but you have to realize that a lot of it is for show, and they want to they want to put you in a place where you feel weak or you feel attacked or exposed. And so there's a lot of nonverbal stuff, and it's really important to understand that the whole thing is somewhat of an exercise. I don't want to say it's a game, because obviously it's not a game, but there is a back and forth. There's a repartee where it is, there is a give and take, and there is somewhat of, sticking to your guns and holding your own. And so, never be, it's important, or it's hard sometimes, but it's really important to never be intimidated, and realize that as the expert that's being deposed, we really hold all the cards and have the kind of the high ground, or the upper position, because we have the knowledge, and we can always fall back on knowledge and our expertise. And we can, usually, as long as you can keep composure intellectually, then you have your full range of tools. The moment we start getting real stressed and start feeling attacked and start feeling defensive, that's when things start to unravel a little bit, and that's what they want. They want to pry underneath and make you look bad and discredit you. So that's the other thing I would say, but there's so much more.
Yeah, there is. I love that last sentence that you said that. And I think that's probably what just about everybody listening who has an interest in being an expert needed to hear. You're the expert. You're the person with the knowledge. You're the one on top. Just stay cool, composed, and know what you know and say what you have to say. That's really good, because the thought of deposition in trial is terrifying to many people. And I think it's why a lot of physicians and nurses and other healthcare professionals never go into expert witness work, because they're like, if I have to go to trial, I'm not going to do it. But thank you. That's a great answer. You also made me feel a lot better. So thank you for that. I could go into next week with a little bit more confidence. Yeah, I hope so. Thanks. One chapter explores the future of expert testimony, including the use of artificial intelligence. How do you see AI reshaping the role of medicine and the expert in the next 10 years?
Everything is going to change. And 10 years, I'd say 5 years, and we have no idea what's really going to happen and how much of it is really going to be groundbreaking like, are we going to cure all cancers? Are we going to do all this stuff? I think nobody really thinks so. That seems too good to be true. And, I think we're all dubious that we're going to get that far, but who knows? There's a non-zero probability. Law, obviously, as these systems get smarter and smarter, any intellectual work, I think there's going to be, AI is going to be used as a tool. And I've already seen opposing counsel expert witness. I've seen expert reports which were AI generated, and it was obvious, and I couldn't believe it. Especially since now there's a lot of AI slop, and the arguments are usually on the surface kind of obvious, but frequently pretty weak. There's already news and cases about attorneys getting into big trouble because AI hallucinates, and it'll hallucinate case law. It'll hallucinate studies. So if you're an expert and I think that using AI as a tool in medicine and law is not only unavoidable, but it's going to be more and more in the future. And what I've found, and speaking to my colleagues and speaking to attorneys and other physicians, is, AI as a tool is only as good as you are as a prompt writer and a thinker and an expert. So, the more detail and specific and compelling your prompt is that you write, the deeper an answer you're going to get. And I would say that no experts really should be writing reports with AI, because or a book or any other kind of authentic material. Because first off, AI is not super intelligent yet; it can't replace us. Or our expertise or our experiences, and it's capable of fabrication and lying and hallucinating, which is fascinating. And I think things are going to change as we move towards super intelligence, if that's a thing that's even going to happen. And then all of a sudden we're going to have ultra intelligent systems. But right now, and I think it's important to deal with the right now. I think AI is very, very powerful and good as a tool to use to bounce ideas off of, to think through certain very detailed or arguments. And I think it's important for example, attorneys. If you wanted to get, how might an expert start thinking about this? You could ask a really detailed. You could put in a ton of information into an AI system. Let's just say ChatGPT or Gemini or whatever you wanted to use, and ask it, is this standard of care, or how would you argue this from both sides? And I think that if you garbage in, garbage out, and with AI is like the ultimate confirmation bias creator. So if you were to ask AI, help me create an argument that supports, the fact that this was standard of care, it's going to do that, and it's going to give you an argument. And if and that's a lot different. That says act as an impartial expert witness and provide, given the following set of data and facts and the following articles, provide, a concise summary and an impartial opinion, and then argue against your own opinion. And if you ask an AI a question like that with that kind of a prompt, it might give you a useful output. And that output might be a starting place, if you're an attorney, to understand and create questions to ask your expert. Would you ever replace an expert? Not yet. You couldn't. I mean, you'd probably get in trouble with the court, and it would be nonsense. But I think that in terms of generating questions that you might not have thought of, or if you're an attorney, AI could be useful to generate questions that you can then ask an expert. And I think just like using any tool, like a calculator or a saw or a hammer, you get better and better at using that tool. And I think that AI needs to be looked at right now as a tool, not a replacement for human thought. And as long as you're using it as a tool, then it can be a very useful way to create additional questions, to create additional dialogue, to help think through this with an expert or with an attorney. And it can be useful as a tool. But you always have to be very, very careful. I see some experts, start, writing a disclaimer at the end of their written opinions that say no AI was used in the generation of this report. I actually kind of like seeing that. If I was an attorney, I've advised my attorneys, especially when I saw this one report maybe half a year ago that was clearly written by AI. I mean, it was AI slop. It was like, the M dashes and this isn't just a question of standard of care. It's actually blah, 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 blah. It's like these AI statements that you're like, that just looks like AI. And so I told, my attorney, I was like, I would question this expert, how much he used AI and if this was AI, and I would feed this into an LLM and see if the LLM thinks that this was created by, AI. And you can do that. There are websites and whatnot. So it's real tricky. Things are going to change really fast. I know we've been going on a long time. You might have to make a 2-part podcast or whatever, but I'd say the future is totally mind-blowing, unscripted. Because once you get to super intelligence, then you basically have an AI that has reviewed every single deposition, every single written opinion, every single courtroom, and it's going to know whether an expert is experience or good or bad or being ethical or not. And I'm talking super intelligent, like an IQ 5,000, something we can't understand. And honestly, this gets into a whole, humans are not very good at understanding exponential growth. And we're like right here before takeoff. And so everything could change. I mean, for all we know, this is like crazy, but there might not be, we might not need, most doctors or lawyers in 10 years. So everything is going to change, and it's impossible to see, or it might be a big nothing burger. I'm somewhere in the middle. I think it's going to help. Obviously it's helped us. I think it'll help us create genetic medicine and specific genetically tailored vaccines for cancers before they even take hold, early detection of cancers. I think it's going to be great for medicine. I think it's going to be scary. I think there are going to be a lot of ethical questions. But I think that as an ethical expert, as an attorney, you need to use it. You need to understand it. You need to understand how it's used. You need to understand why and the impact it's having. And because it's going to happen with or without us. So it's not like we can, it's not like we can be in a cave and, not acknowledge how powerful it's becoming. And so it's going to be ever more important, and also important to disclose how much we've used it, what we've used it for. Did we base any opinions based on conversations with AI? How we used it, and so being ethical in stating, our use of it. And so I don't use it very much right now because I think it can very easily lead you down wrong paths. However, I have used it to help guide me to an article that I want to read. And then I actually go and physically look it up, which you must do. You need to do your own work. But it can save you time from like a Google search, looking for appropriate articles and whatnot. Again, there's a whole chapter on it, and I go deep, but there's like the now of AI, and we need to be very careful, and experts need to be very careful, and attorneys should be asking, how much did you use AI? Did you use AI to generate your report? And experts should be prepared to answer those questions.
There is a lot to unpack there. I think you're right. I think once your book is published, I think I'd love to have you back as a guest and go into, because we did touch on a lot of topics, and this all by itself is a huge one and one that everybody's interested in. I just finished a couple of episodes on AI and how it's potentially changing the standard of care and malpractice litigation. And, the conclusion was, first of all, this isn't our first rodeo with new technology that we've had to learn and adapt to and learn to understand and use with a healthy sense of skepticism, particularly in the beginning. And second of all, that it's here. Like, forget about being scared of it or denying it or hating it or whatever your negative stance on it may be. It's too late for that. It's here. So it's finding a way to use it wisely, use it safely, use it professionally. And because here we are.
It's going to change standard of care because it's going to be less appropriate for people to deviate far from standard of care when you have at your fingertips such a powerful tool. Right now, physicians are using open evidence and, evidence-based medicine. If 100 doctors would do something based on evidence, then it becomes less appropriate to deviate from that. So this is going to solidify standard of care, and there's going to be less wiggle room, and there's going to be, more standard definitions and less and less cases where it's appropriate to do something outside of the norm. I do think that there will be a consolidation of standard of care, and I think that's been happening anyway over the last 50 years as technology improves and data and evidence gets stronger for approaching medicine in a certain way.
I would agree. It's become more of a science and less of an art. Although those two things together are still very, very important, aren't they?
The art is so important, and it's still alive.
Yeah, of course it is. Of course it is. Okay, I'm going to ask you one last question that I like to ask everybody who's on the podcast. And this has been a great conversation. And honestly, we'll do it again because there's so much more to talk about.
Yeah, I agree.
But if you could leave these three audiences, patients or the public, attorneys, and healthcare providers, with one takeaway from this conversation that we've had today, what would it be? And let's start with the public. I mean, we didn't really address them in a big way, but what would you like them to know about all that we've talked about today?
Yeah, absolutely. Well, I think it's the same for all three. And the message is be authentic, be honest, and have integrity. I think that 99% of us, I mean, we know the lessons we were taught as children. We know right from wrong. And you can feel, I think that there's a natural, it's almost like we need a word to describe it. We've been using the term spidey sense, but I think when you're getting into a gray zone. And I think that there's a lot of incentives in society to make money or to, somehow get revenge or to have some kind of ulterior motive. But I think that we know when things are right or wrong as people and as human beings. So I'd say it's the same kind of message for everyone, because certainly there's a ton of court time that is wasted with matters that should not, there's other ways to deal with these things. But, I think a lot of times these things happen because communication wasn't good in the first place, and bedside manner wasn't good, and compassion wasn't there. And so there's a misunderstanding, and that results in a lawsuit. And then once you're committed to something, you don't want to back down. And so I think the message is, we're all in this together. We're all family. And this is like a very human thing. I'd say the ultimate goal for all humans is to, increase net happiness, health, well-being, and joy in the world for everyone else, for yourself and everyone else, your family, your extended community, and everyone. And as long as we can aim for that kind of more, and it's not realistic because it's not unfortunately, how it works in this competitive zero-sum gain world. But I think that if we try and align all of our incentives to a more compassionate understanding, a human understanding of what our fellow human is going through, and have a perspective that others are viewing these matters from. So if you're the public, or if you're the judge or the jury, or if you're another attorney or even the expert, it's really important to put yourself in the shoes of first, the people who are really at the heart of the matter, the plaintiff and the defense, and what they're seeing, what they're thinking, and what they're feeling. But then also the healthcare provider that was involved. You really need to, if you can, in a very compassionate way, understand that people have real emotions, and this is affecting someone's life, not only right now, but maybe far into the future, and it can be very scarring. And so it's important to be authentic, and it's important to again, attorneys can be forgiven somewhat. There's an old phrase in law, if the facts are on your side, pound the facts. If the law is on your side, pound the law. If neither are on your side, pound the table. And, that's not our job as experts. As experts, we need to stay impartial, and we need to stay, there's no pounding the table. There is pounding the facts, and that's it. We are fact pounders, evidence. And, it's also important to be authentic. And if you feel something, if you feel compassion for somebody on the other side, let's say, share that and say, this is such a tragic outcome. I feel for you. This is horrible. It doesn't mean that there was a breach of the standard of care. And it's important that we understand and we look at it, because I want you to understand that what you're going through is totally valid and horrible. And my heart goes out to you. And we need to recognize, though, that this healthcare provider also was just trying to do the right thing for you. And 50 other healthcare providers out of 100 might have done the same thing. And we just don't know the outcome all the time. And so, if you're authentic and compassionate, that goes a long way. And so I think that's the main message I would want to get across to people is in no matter what you're doing, but especially this line of work, compassion and integrity need to be those primary pillars.
That is 100% not the answer that I expected, but it is absolutely one of the favorite answers I've ever been given to that question. So thank you. Thank you so much. So tell us, when is this book, The Ethical Expert Witness, when might it be available and where might it be available? Any news?
Well, I've written a couple other books, and I'll tell you, once you get done writing, that's when the real work starts. Mm-hmm. So I'm almost done writing it. I've got most of the chapters done, and most of them I have a whole blog series and like a blogcast and video vlog, but the chapters were built out from those because the feedback was great. And so I'm almost done writing, and then I'm going to take all of fall to really go through reading, rereading, give it to people I really trust and love, and who I respect. And I would say hopefully I'm aiming for January, February. Thanks for taking such an interest. It's kind of strange to talk about a work that's not quite out yet, but it comes up, and it is, the stuff is fascinating, and I really love this work. It makes me a much better physician. I think it makes us better at what we do. The further, I'm 50 years old now, so the further I go in my career, I've got a 14-year-old, and it's just more important to contribute to, not only on the front lines as a doctor, as a healthcare provider, but to the whole process, because, we are healers, and healing takes place, you start to understand outside of the role of medicine, and it manifests in everything that you do. If you're a healer, then it's not like you leave that at the door and hang up your stethoscope. You go out in the world and you want to teach and heal, and you need to learn and be healed, because we're all these imperfect beings. So I've enjoyed this conversation immensely, Chris. You're really, really good at asking great questions and getting to the heart of these really intense topics.
Thank you. I've enjoyed it too, honestly, every minute of it. So until the book comes out, where could people find you said you've got some writing in a blog. Where is that available that people could go and read that?
Sure. Well, my website is, what is it? It's kaufmanmedicalgroup.com. It's KAUFMAN, one F, one N, medicalgroup.com. And there's a link to the vlog on there. I think there's a link to the vlog on LinkedIn as well. And LinkedIn, I'm at Noah Kaufman, MD. I also, Kaufman Medical Group has like an Instagram where I think we post that vlog as well. My personal Instagram is just, cooking and life and my kids' soccer games. So you might not want to see that. But and then I do some medical legal talking in other communities and whatnot. But people can reach out to me anytime through my website. Kaufmanmedicalgroup.com is probably the best place to get in touch with me, or email me. My email and phone number are in there. And I love talking to people. Thank
you, Noah, so much for joining me today and sharing your insights and the generosity of your time and your knowledge. Again, I've enjoyed it. Thank you. Thank you.
Chris, it was wonderful.
For those of you listening, whether you're an expert witness, a healthcare provider, a manager, a lawyer, a risk manager, a patient, or an advocate, I'm going to bet that you love more of Noah's information on either his vlog, his website, or the upcoming book will be a great read for everyone. And if any of you have been interested in stepping into the role of expert witness work, and I hope this was insightful to you, but you could also check out my website, connectmlx.com, for more information and an opportunity to join our team with lots of mentorship and support and lots of ethics, in the background. Noah and I are on the same page on just about everything we talked about. Also, to all of you listening, thank you for joining us. If you've enjoyed today's episode, please like, subscribe, and leave us a review. And don't forget, in most jurisdictions in Canada and the US, nurses, doctors, lawyers, attorneys can all earn continuing ed credits just for tuning in. And as always, you can find more resources and past episodes of this podcast on Connect MLX and the Inside Medical Malpractice YouTube channel. So tune in next month for another great episode, and tune in the future because I'm sure that Noah has more to talk about once that book is out, or maybe before. And goodbye for now, and take good care.